everyone. Well, we will get started then. So, good afternoon, and welcome to this informational webinar on how the Inflation Reduction Act's prescription drug provisions will impact Medicare beneficiaries, which is hosted by U.S. Senator Bob Casey's office and the Centers for Medicare and Medicaid Services. And we're grateful for everyone taking the time to join this call today. I want to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Hulan Bakalis. And from Centers for Medicare and Medicaid Services, we're excited to introduce Sharon Graham, who is the Regional Administrator and Staff Director for CMS Philadelphia. And we're grateful for her willingness to join our office for today's webinar. And then just before we get started, I'll quickly note that if anyone has questions, to please hold them until the end of the presentation when we'll have a Q&A session. And we ask that you please keep your questions general and applicable to as many people as possible since this is a public call. And if you have questions regarding your own specific situation, contact information for Senator Casey's office will be provided during the presentation for you to reach out to us directly. And at this time, I'm going to turn the call over to Sharon to delve more into the specifics.
Andrea, thank you for that nice introduction. I appreciate the time being here today and to be able to share the great benefits of the Inflation Reduction Act with the Senator's office as well as all the folks out there across Pennsylvania. The Inflation Reduction Act, throughout the conversation we have today, I'll be referring to it as the IRA. So the Inflation Reduction Act was passed in August of 2022, but some of those first benefits that I'll discuss actually took effect almost right away in the fall of 2022. Many of the benefits then will continue to roll and be effective through the course of not only this year, but several years beyond. And I'll be speaking to those more directly as the presentation goes on. But we do expect, and I think you'll understand as you hear these benefits, that we know that these benefits will be of value to millions of people, not only in reducing healthcare costs, but also in reducing the out-of-pocket costs you have for prescription drugs. So first, I want to talk about one of the benefits that took effect actually last year, and that's as it relates to the marketplace, that is the Affordable Care Act. And what the Inflation Reduction Act, the IRA, did was to provide what we call enhanced subsidies to help underwrite the costs that people pay for their premiums and their out-of-pocket costs in the marketplace. And as a result, since premiums came down and people's out-of-pocket costs came down, we saw record enrollment in the marketplace. More than 16 million people now have access to low-cost, high-quality health insurance as a result of those subsidies. And in fact, we estimate that about 4 out of 5 people who select health insurance through the marketplace were seeing savings of they were paying premiums no more than $50 a month, and they were saving upwards of $800 a year, at least with these subsidies through the Inflation Reduction Act, which is really great. Then moving on to the Medicare benefits. First, to talk about insulin, because this is really one of the first benefits that took effect at the beginning of 2023. Insulin can be expensive. And in fact, for Medicare beneficiaries, when we did our own studies here at my agency, the Centers for Medicare and Medicaid Services, we found out that about 37% of people were paying more than $35 for their prescriptions, for their insulin prescription. And in fact, 24% of Medicare beneficiaries were paying even more than $70 per prescription for their insulin. So starting in 2023, the first thing that the IRA did was it capped insulin expenses on Medicare Part D to $35 per prescription. So again, that's Medicare Part D, $35 per insulin prescription. And that benefit started on January 1st. Now, for people who get their insulin through Medicare Part B, that is, those are people who will be using an insulin pump to get their insulin, that benefit kicks in on July 1st. And the benefit is the same. Insulin provided through a pump will also be capped at $35 per prescription, and that starts on July 1. So we estimate that as my agency that about 1.5 million people with Medicare will benefit from this amount to the tune of about $500 per year savings. And for some people, it might even be more than that. Now, specific to Pennsylvania, what we estimate is there are about 80,000 people with Medicare who will save an average of about $543 a year, thanks to this new cap on the insulin benefit. So moving over to vaccines, millions of beneficiaries take advantage of the free vaccination coverage through Medicare. And that's whether you get your Medicare through original Medicare or a Medicare Advantage plan. And also starting on January 1st, any vaccine provided by Medicare Part D that has been recommended by what we call the Advisory Committee on Immunization Practices, or ACIP, and this includes the more expensive shingles vaccine as well, will be provided to all Medicare Part D enrollees at no cost. So again, all vaccines recommended by ACIP, including the shingles vaccine, are now available under Medicare Part D at no cost. So just by way of comparison, before this year, there were about 3.4 million Medicare beneficiaries who were receiving their vaccines through Part D and were paying on average about $70 per vaccine. So you can imagine from $70 down to now $0 for the vaccine. And specifically for people here in Pennsylvania, those savings were around $60. That's $70 a national figure. In Pennsylvania specifically, it'll be saving people about $60 per vaccine, which is pretty nice. So now looking at Medicare Part D, and that's the part of Medicare that covers your prescription drugs. Actually, the IRA had many improvements that are going to keep costs for prescription drugs down. So let me start first with the low income subsidy. Currently, people with incomes at or below 135% of the federal poverty level, and if they also have limited resources, they get what we call full financial help for their Medicare Part D prescriptions. And then for people who fall in that window of between 135% and 150% of the federal poverty level, get what we call partial help with their Medicare prescription drug costs. Now, what does full help mean? And this is important to understand the benefit. If you get full help with your low income subsidy, you are having for your Part D Medicare expenses a $0 deductible for that plan, and your co-payments on your prescription drugs can be as low as $1.35 for generics or $4 for brand name drugs. That's what full help is. And what the Inflation Reduction Act does is to offer full help for your Medicare prescription drugs up to a 150% of the federal poverty level. So now starting in 2024, anybody who is up to 150% of the federal poverty level will receive full financial help for their Medicare Part D drugs. Now, also starting in 2024, for those of you who have Medicare Part D, you might know that there's a catastrophic phase. If you spend about $7,400, which is a huge number, out of your own pocket, then you fall into what's called the catastrophic benefit. And when you're in the catastrophic benefit, you only pay about 5% for your prescription drugs. But starting in 2024, that catastrophic coverage is going away. In essence, you will have no out-of-pocket costs once you hit that catastrophic phase. So again, the catastrophic amount does change year to year. For 2023, it's currently $7,400. But for anybody who does have high prescription drug expenses and hits that catastrophic limit, your out-of-pocket cost sharing will now be $0 starting in 2024. And starting in 2025, we'll be implementing what we're calling a smoothing benefit. And what this in essence means is that beneficiaries, well, first let me say, starting in 2025, your out-of-pocket costs will be capped at $2,000 total for the Medicare prescription drug benefit. And then starting in 2025, you'll be able to smooth your out-of-pocket costs. And by that, what we mean is you'll be able to spread your out-of-pocket cost payments evenly over the full 12 months rather than perhaps paying a larger amount in January and February and then maybe nothing the rest of the year. You can spread that out over the entire year. So that's an exciting new benefit. And again, that's 2025. And then lastly, premium increases for Medicare Part D plans will be capped at 6% a year starting in 2024. And so anytime 2024 and beyond, the Medicare Part D plans can no longer increase their premiums any greater than 6% a year. So that is really huge. We are also going to be putting a cap on manufacturer rebates to Medicare. And what this means is that when a prescription drug's prices rises faster than the current rate of inflation, those manufacturers will have to pay a rebate back to Medicare. And that rebate will go right into the Medicare trust fund to help offset the cost of other benefits that we pay for our Medicare beneficiaries. And we also expect that by having the manufacturers pay these rebates, it's really going to keep a cap on the large increases that we often see in prescription drug prices. Now we're going to start tracking these drugs against the inflation rates this year, in fact, in 2023, but we won't be invoicing the manufacturers until 2025. But those invoices will reflect any of these inflation-related changes going back to 2023. However, even though Medicare won't be invoicing the manufacturers till 2025, you can start seeing the benefits today. And in fact, for certain drugs, these rebates started to affect Medicare beneficiaries in April, actually, because for Medicare Part B, your coinsurance is tied to, as you know, is 20% of the cost of a particular Medicare Part B benefit. Well, what we've told the manufacturers is that if your drugs are rising, their cost is rising faster than inflation, and we've identified the drugs, in fact, there are about 20 of them that we published back on April 1st, that their prices increased faster than inflation, those manufacturers already have to reduce your coinsurance at the point of sale when you're buying one of those drugs. And sometimes the dollar amounts are pretty small, just a couple of dollars, but we're finding that beneficiaries can probably save in the average of $350 to $375 a year in their out-of-pocket costs as we continue to roll out and adjust this benefit. But just by way of example, to compare the biggest out-of-pocket change, it's for a drug called Carnitor, which is for anybody who has end-stage renal disease. If you keep in mind that typically a person getting this drug would have paid 20% for the cost of the drug, because its rate of increase was higher than inflation, Medicare beneficiaries on April 1st no longer have to pay 20% for that drug. They're only going to be paying 14% of the cost of that drug. So that extra 6% is going right back into the Medicare beneficiary's pocket. And that's the case for about 20 drugs in total starting April 1st of 2023. And lastly, it's probably the piece of the Inflation Reduction Act that really got the most news coverage is the drug price negotiation. Medicare is now finally allowed to negotiate the price of certain drugs. And starting in 2023, we will be issuing the first set of drugs, the names of the first set of drugs for which we're negotiating prices. And we're going to be issuing the names of those drugs on September 1st, 2023. It will be 10 Medicare Part D drugs, high cost Medicare Part D drugs. And our negotiated prices will go into effect in 2026. And then we're going to be in 2027, there will be 15 drugs that will be posted for negotiation, both Medicare Part B and Part D drugs. And then in 28, the number goes up to 20 Medicare Part B and Part D drugs as well. And then it's 20 from then on forward. So every year we'll be negotiating a new set of drug prices. So based on that, we're estimating, my agency, CMS, that about 7 million Medicare beneficiaries will see their drug prices go down as a result of this particular drug price negotiation. And again, you'll be seeing those first savings in 2026. So those are really the key highlights of the healthcare improvements thanks to the Affordable Care Act. My agency is working hard behind the scenes on all of the benefits that I've described for you, and especially around the drug price negotiation, because we want to be able to hear from people directly who are affected by and impacted by the prescription drug costs. So we're working with people like Senator Casey's office, with constituents like yourself, to make sure that we're bringing that information back to implement these benefits successfully, not only this year, 2023, but beyond, because as I mentioned, the Inflation Reduction Act will be rolling out many of these benefits over the next couple of years, and you'll be able to see those savings in your pockets pretty soon. So with that, I want to thank you for listening, and I'm happy to open it up to answer any questions. I'm also joined today by my colleague, Monique Scott, and the two of us together will hopefully be able to answer your questions.
Thanks, Sharon. We'll hold Q&As for after Senator Casey's presentation, but we will open it up And then, but thank you again for sharing that important information. And now I'm going to provide an overview on how Senator Casey's office may be of assistance to constituents regarding Medicare issues and navigating federal agencies. So if you want to go to the next slide. Thank you. So, Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing issues with a federal agency. This includes, but is not limited to, Social Security benefits, missing passports, IRS problems, VA benefits, immigration snags, SBA concerns, and so much more. And it's important to note that if we cannot provide assistance, such as with a state or a private entity, we can refer constituents to someone who can best help. Next slide. Thank you. So with regards to Medicare, we can assist constituents by reaching out to Centers for Medicare and Medicaid Services, or CMS, when it comes to Medicare coverage issues and Medicare Advantage, also known as Part C, and Medicare Part Prescription Drug Plan issues. Common casework within CMS includes issues with claims payments, coordination of benefits, Medicare as a secondary payer, issues with Medicare enrollment, and coverage of medical equipment, home health, hospital, and hospice care. We can also assist constituents with navigating enrolling in Medicare Parts A and B, which is handled by the Social Security Administration. To the next slide. Thank you. So if you would like to request assistance from Senator Casey's Office of Constituent Services, either with a Medicare or Social Security question, or for any other issue with a federal agency, please do not hesitate to contact our office at 717-231-7540. You'll select option 2, or our toll-free number, which is 866-461-9159. You can also reach out to, via Senator Casey's website, which is on the screen. So we will now open this portion of the presentation for questions for CMS or Senator Casey's office. If you have a question, you can click the raise hand button at the bottom of the participants list to indicate that you have a question. I will call on participants that have questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you have a specific issue, please contact us via the information on the screen. So I see Rosalie Young has a question. Rosalie, you're unmuted, so go ahead and ask your question.
Yes, good afternoon. I have a question that someone asked me. Is there some kind of rebate that Medicare is giving out? I'm not sure about it. I'm just inquiring.
Hi, Rosalie. This is Sharon Graham. While there's no direct rebate that Medicare is giving out, there are some savings that people will see with the Inflation Reduction Act. For example, right now we have the $35 insulin cap. Many people were paying a lot more than that for their insulin before 2023. And then starting next year, people of up to 150% of the federal poverty level will see extra help paying for their prescription drug benefits, for example, and won't have to pay a premium. I wouldn't necessarily call some of those savings a rebate, but they are definitely savings that you'll see in your pocket. You'll put that money back in your pocket.
Okay, thank you.
Sure, you're welcome.
All right, and if anyone else has any questions, feel free to raise your hand. Next, I see Alex has a question. Alex, you're unmuted.
For constituent service stuff, can you all help? What is the process for people who are denied claims through their Medicare provider, and how long does that normally take if you're able to help them?
Sure. So of course, each situation is a little different. So the time line on getting a response from CMS is, it depends on the situation. Usually we allow them about 30 days to respond to our office. So usually we expect a response, within that 30 days. And how our office can help if someone is denied a like a benefit of some sort, we can reach out to CMS to ask why it was denied, get some clarification on that. But of course, every situation is different, so it would just depend on the situations around that case.
Is there, I mean, 30 days is, I guess, pretty quick maybe, which is great, but if it's an end of life situation when a person is on hospice and maybe they don't have 30 days.
Yeah. In those situations, we let CMS know that there is like a dire need.
Okay.
And usually we get a response very quickly once we let them know there is that dire need.
Yes, and to follow up, completely agree. We do have a process in our regional office, which is in Philadelphia, to escalate cases that the senator's office would flag as dire need or an urgent need. We do that regularly.
Anyone else has any questions, you can feel free to raise your hand. Okay. I'm not seeing any more questions. If you do, leave this presentation and you do have a question, then feel free to reach out to Sarah Casey's office and we can answer your question. But I want to thank everyone for taking the time out of their day to join us, and I wish you all a good rest of your day.
Thank you. Have a great day.